everyone. My name is Babu Mohan. I work with the Department of Internal Medicine at University of Arizona, Banner University Medical Center, Tucson, Arizona. On behalf of my co-authors, Dr. Saurabh Chandan from University of Nebraska Medical Center, Omaha, Nebraska, Dr. Andrew Ofosu from Brooklyn Hospital, New York, Dr. Daryl Ramay from Brooklyn Hospital, New York, Dr. Suresh Ponnada from Carilion Clinic, Roanoke, and our senior author, Dr. Douglas Adler from University of Utah, Salt Lake City, USA. I thank you all for watching this author interview on our paper, Anterior versus Posterior Myotomy Approach in Peroral Endoscopic Myotomy, a Systematic Review and Meta-Analysis. Since the introduction of POEM in 2008, it has become and gained worldwide acceptance as the primary treatment for patients with achalasia. POEM can be performed via the anterior or the posterior approach. The anterior approach involves performing myotomy at the 1 o'clock to 2 o'clock position, and the posterior approach involves performing myotomy at the 5 o'clock to 6 o'clock position. Theoretically, the anterior approach may reduce the risk of damage to the angle of His and the sling muscle fibers, which may have a big impact on the post-procedure incidence of gastroesophageal reflux disease. On the other hand, the posterior approach allows for superior alignment of the endoscopic tools used to perform the myotomy, as the working channel for most endoscopes is located over the 5 o'clock or 7 o'clock procedure. Currently, the data comparing these two approaches is very limited, and there is a lack of standardized training curriculum for this procedure. We did this meta-analysis aiming to provide a robust data comparing these two approaches in the procedure of POEM. We included 18 studies in the final analysis. The total number of patients were 1,247, of which 623 underwent POEM via the anterior approach and 624 underwent POEM via the posterior approach. Based on our pooled rates, the pooled odds ratio for clinical success at 12 months of outcomes and the rates of GERD as assessed endoscopically as well as by pH measurement were comparable between the groups. We had 4 studies that had head-to-head comparison between these two approaches. We also included multiple other studies where we had pooled rates of anterior approach and pooled rates of posterior approach, and we did a non-causal subgroup comparison to see how these two outcomes compared against each other. The pooled clinical success at 12 months with anterior approach was 91%. The pooled clinical success with posterior approach was 93%. The pooled clinical success for studies with greater than 12 months follow-up was 89% for anterior approach and 93% for posterior approach. The rates seemed comparable between these two groups. The pooled rates of gastroesophageal reflux disease by symptoms was 28% with anterior approach compared to 17% with posterior approach. GERD by EGD findings was 22% in anterior approach and 19% with posterior approach. The same by pH measurement was 34.5% with anterior approach and 40% with posterior approach. All these rates seemed comparable between the two groups. One of the key findings of our study is the pooled procedure time. With anterior approach, the overall pooled procedure time was 83 minutes, whereas with the posterior approach, it was 62 minutes. Although this is understandable based on the better alignment, faster and easier completion of procedure with posterior approach, we did notice high levels of heterogeneity, which could have been due to differences in operator experience, partial or full thickness myotomy, which are key factors for the operation time. In conclusion, based on our meta-analysis, anterior and posterior approaches seem to have comparable outcomes in terms of clinical success and the incidence of gastroesophageal reflux disease in POEM procedure. Our data on 12-month outcomes were pretty robust with minimal heterogeneity, and our data on the time seemed to suggest that posterior approach can be completed in a much shorter time as compared to anterior myotomy. Achalasia type or any prior treatment did not seem to influence our reported outcomes based on our meta-regression analysis. I once again thank you all for taking the time to see this video statement for Endoscopy Journal.